Hearing is crucial for childhood development, impacting speech, language, communication, social skills, listening, attention, and learning. Some hearing loss can be detected early by newborn screening, but some hearing loss develops or progresses during childhood. In the first 2 months of life, a baby startles to loud sound. They also blink, stop sucking, or turn towards ongoing sounds. By the 3rd and 4th month, babies will turn their head towards familiar voices and get excited by certain sounds, such as footsteps. Babies will make soft sounds themselves. By 6 to 9 months, babies will start to respond to their own name. They will babble tunefully, express emotions such as squealing or laughing, and use their balance skills to begin sitting up. Babies will take turns babbling to an adult. They will turn their head towards sounds and recognize familiar voices. By 1 year to 18 months old, babies are often taking their first steps and saying their first words. They understand words such as no and can communicate by pointing or waving. 1-year-olds will copy sounds and play peekaboo. Concerns about development at this age would be a child who is not babbling, pointing, or waving. By 18 months, a child should know familiar objects, such as a cup, and be saying at least 1 to 8 words. By 18 months, it would also be concerning if a child was not showing any signs of walking or was tiptoe walking. By 2 years old, a child should be putting 2 words together and have a vocabulary of around 50 words, although the normal range is anything between 600 words. 2-year-olds are walking upstairs using 2 feet per step. Two-way conversations with the child copying words is seen, and a 2-year-old can follow simple commands or instructions. 2-year-olds will usually talk to themselves while they play, even if it sounds like babble. Parents should be encouraged to share rhymes and songs with their child and respond to their child's attempts to communicate using voice, gesture, and facial expression. By 3 years old, children should have a large vocabulary that is understood by others. Children can often balance enough by 3 years old to start to jump or balance on one leg.
The inner ear shares the same blood supply and fluid as the balance system in the body, also known as the vestibular system. If the hearing system is affected by a condition or has formed differently at birth, sometimes this will include the balance system. Vestibular problems may affect motor skill development such as sitting, standing, walking, and learning to ride a bike. Most children will compensate over time and learn to rely on their visual skills and proprioception to maintain their balance. Since they are relying on visual feedback, eyesight needs to be supported with good lighting and eyeglasses if needed. It is possible for children to compensate for balance difficulties over time, making them barely noticeable. However, certain activities may be less safe, such as swimming, where proprioception and closing their eyes underwater may result in disorientation. Therefore, they should always swim with a companion.